presentation because one of the two presentation couldn't. No, this I did it. This one.
This one?
No, the first one. And I need to do the thing with the slide.
Okay. Ποιο?
Κύριο, αυτό είναι και το
φαντάζομαι δεν θα αλλάξει από χθες. Okay.
And if I wanted to show something.
Ναι, το είδα. We will bring you a pointer.
And with this one I change the...
You can change the slides and point, but not with that.
Okay.
No, I think it's that one's fault. Okay. Which one?
Consortium meeting address here. No, just here.
Okay.
This one and WP8. Yep.
Okay.
So good morning. One question is if everyone has received the USB stick yesterday. There is, okay. No?
I thought we were to continue with the rest of the extra sticks.
Christina has the... So I think that it's important to start with what is written in the grant agreement and in the policy deliverable. We say that thank you. Okay, the middle one.
Yeah.
Okay. So we wrote that we will produce a plan with strategic recommendation for policymakers and regulators. We say that we will provide guidance for decision makers involved in public health and environmental policies. We say that we will identify relevant policy maker, regulators, civil society, stakeholders, and establish direct interaction with them. The European Union gave us funding to find evidence, and they wish that we find evidence that will have an impact on European citizens. And so at the end of this 5 years, and also even before that, we will have some results. And but I think that the question is how do we make the results actionable? What we do with these results? Who can be interested? Who is my target people to incorporate? Why the research findings will be relevant? The question is, what should people do differently given remedial results? How should this research influence policymakers? Let's take a fictional example. We will find that people who works in a restaurant has more risk to develop COPD. We didn't know before, people working in the restaurant didn't know, the policymaker didn't know. When I have this information, what can I do with that? What change can I make that has an impact? What is the chance that this recommendation, this evidence will be implemented? And how we can make sure that these results are translated into actual policy change? I don't know, a private sector, an industry will change their behaviors because Remedia wrote a report or a scientific article. And it's probably not enough. So this is where communication dissemination, exploitation of results, and advocacy can come in. It's like a long process all along the project with at the end advocacy and the impact. So it's a path where there are plenty of steps between all the research work that you are doing currently, a scientific article, a report, and a policy change. And the thing is that one thing is that you don't have to wait the results. It's what is important is to raise awareness At the end, we can have the best message, the best results, but we will not have an impact or a big impact if people don't know us. So what I mean is that we have to prepare people for the result that will come. So when yesterday, for example, I presented the WP7, I spoke about the idea to have a stand in some conference where we can speak with people that could be interested. This conference is not only for researchers. It brings together all the stakeholders around the respiratory disease, patient association, and all people interested. So it's a great opportunity to raise awareness about the impact of the exposome on respiratory disease and research that Remedia is doing. So, but what is advocacy? If I take the definition, policy advocacy is a deliberate process. It's aimed to inform and influence decision makers. Policy advocacy seeks change that are evidence-based, and the ultimate goal is to achieve a desired policy change or ensure that an existing policy is implemented. There are different types of policy change and policy implementation. So policy change can include updating or amending of an existing policy, developing a new policy. Policy implementation can include disseminating a policy or enforcing a policy. And to be effective in advocacy, you of course need a plan. A systematic approach. So an advocacy plan is a framework that determines what policy and practices we want to see changed and how we want them to change, and the way we are going to do our advocacy work to achieve our desired change. And the planning is important because it allows us to clarify what we are trying to achieve and how we are going to get there, to allocate resources, to force us to think ahead and prepare to future eventualities, including potential problems and opportunities. There is this 10-part plan. It's no matter what the health issue or the level at which we seek a change globally, nationally, or within a community, this framework will provide some information and tools you need to develop an advocacy message. So if we look in depth, just some question. One is, for example, what is your advocacy issue? This is the first, most critical stage of the process. Your issue should be specific and clear. What is your advocacy goal? This is your policy solution of the issue, or what you would like a policymaker you do to address it. Who are the decision makers and the influence? Who have the power to give you what you want? What are their interests? This is really important. What opposition obstacle exists? Who are your key partners? And what are the most powerful messages? So you use what you know about your decision maker interest to develop a compelling message. So it's how we can influence a sector. And it's important, for example, if I speak 3 hours with someone that doesn't have an impact, I will obtain nothing. So one of the more important steps is to find people whom I can influence, but also that can have an impact and who can help change things. What you need is to have the right message with the right person and the right timing. So we are going through some of these questions with some example. So the first one, what is your advocacy issue? So what is a good advocacy issue? It should be based in evidence with proof that your issue is in fact a problem. A change in policy or implementation of policy should help to improve the problem. It should be reasonably specific and clear, not broad. So broad health topics like HIV, gender-based violence are too general to develop a message. And a main problem is typically a challenge that impacts people. And it should be reasonably attainable in 3 or 5 years. And next, you have to identify the root causes of that problem. And it's the root causes that tend to become your specific issue for advocacy. So this is a worksheet that people working in advocacy use. And so you indicate here the main problem, and for a given problem, you will have some root causes. And for each root causes that you will find, you try to answer to this question. If you will want to identify 2 or 3 root causes to a given problem. And then you ask yourself this question. If you answer no to any of these questions, choosing that root causes could be like a waste of time, of your time. It will likely not be an effective issue for advocacy. If we take an example, if the main problem you want to address is that, for example, that too many infants contract HIV from their mother, we take 2 root causes. One is, for example, poverty, the poverty of the country where this mother lives. And another one is that pregnant women have limited access to nevirapine. Nevirapine is the leading drug to prevent the transmission of HIV from mother to child. And here you put poverty, and here the limited access to nevirapine. Which one do you think it's a good potential issue for advocacy? So you have the question are, for example, do you have any evidence that this root cause is in fact an issue? Can a change in policy or implementation implementing an existing policy help improve the root causes? Can the root cause be reasonably addressed in 3 or 5 years? Any idea?
The second one.
Yes, because you need a root cause on which I can act. So poverty, you can't address it in 3-5 years. After selecting your advocacy issue, it's important to develop an advocacy goal to focus and guide your strategy. So an advocacy goal has typically 4 parts. What is the change that I want to happen? How is the specific action a decision-making institution can take to make the change a reality? Who is the decision maker, the decision-making institution that will provide your solution? And when is the time frame? So if we take the example of the pregnant woman with the limited, so we decided in the previous slide that a good route advocacy issue could be pregnant women that have limited access to nevirapine. Perhaps to address this issue, the what is that you would like to see happen is that administration for nevirapine is made a standard of care for prevention of mother-to-child transmission. How is this may happen through an amendment to the National HIV Strategic Plan. And once you have your what and how, you can think to who can do that. And so it could be the Ministry of Health, and when you will decide when. So if I say the policy advocacy goal is the Ministry of Health will amend the National HIV Strategic Plan to make nevirapine the standard of care for prevention of mother-to-child transmission, and plan for rollout in national public health facilities by, I don't know when we decide. And there is usually more than one policy solution to any advocacy issue. And then we have who can be interested. We have the stakeholder. It's not only the decision makers. You can see the decision makers are in the middle. And stakeholders are individual or organization that have an interest in your results, or that they are affected by your results. They are also partners, and they will help you to shape the message, and they will also help assess decision makers. So at the middle we have the decision makers. The decision makers are the people with the power or authority to make your advocacy goal a reality. They can exist at global level, national level, or subnational level. And another important target of this strategy is key influencer of your decision makers. Key influencers are those people or groups who can have a compelling force on the action, opinion, or behavior of decision makers. Even if you have direct access to your target decision makers, it can be useful to reach these people, to reach the decision maker through these people. In the category of key influencer can include academics, civic leaders, journalists, and then you have also allies and partners. It's people that you engage also with the influencer and the decision maker. And in order to best persuade your target decision makers, you will need to understand the their level of awareness of an issue. They can be accurately informed of the issue, not familiar with the issue, and you need also to know their current position on an issue. They can be high supporter, low supporter. They can doesn't have any opinion, or they are clearly committed against your viewpoint. And I propose you something. If you have your smartphone, I don't know if it's going to work. So you go on Slido, and you use the QR code, or you do /130460. And you answer this question: who can be interested? Now that you know what is a stakeholder, who can be interested in the Remedia project? Who do you think? No. Usually you have to put this 130460, and you can write your answer. So great, so Ministry of Health, Association, VLM, Health Insurances, European Commission, Population, Clinics, Environmental Association, Caregivers, Pharma, Macron. We go at high level. If you know the K influence for Macron, just tell me. Media, yes. Okay. And so I give you some so who can be interested? We can say that there are internal stakeholder and external stakeholder. So internal stakeholder, it's you, for example. It's all Remedia partners. It's the executive committee. You are interested in the project, and there are by the result, and it will influence you. External stakeholder is EN. They have so many interested in all the 9 projects, patient association, NGO, academic and research community, international organization, the European Commission, policymakers. And so internal and external stakeholders need to be engaged through the policy-making process to ensure that evidence can inform policy. So one of the points that is that we don't have to wait the result. Already the people, that people let people know us and speak about Remedia, the Exposome. People don't know, is not aware about the Exposome, and EN, we have to prioritize opportunities for influence. create a persuasive advocacy message. We will have several policy workshops with the spare budget. It will be an occasion to invite people that you know, stakeholder that you know. So I put 6 months, choose three stakeholders for part. If you have some idea, you just write me. So we need the right person, the right message at the right time. And if we go back we do another Slido, if you want. You will do the same thing. So another question is, what could be one thing that an action stakeholder to target first, place to be, a message to share that you think we should start in this year? So I imagine is to target first patient association. The abstract too, yes, it's a good idea. I think who wrote that? I know who wrote that. Yes, be present, be in the scientific conferences. TV interview, webinars for public dissemination. Only 5 people who answer. Be more active on social media, yes. Yes, Ministry of Health. Okay. Yes, school sensibilization. Link our interviews to Remedia website. I think that for example, we can do a press release after this consortium meeting. Could be a good idea. Okay. Twitter, yes. I don't know if my presentation is finished. I don't know if you have any questions. Everything's clear.
Thanks a lot, Roberta, for this presentation. I think it's really time, yes, to really think hardly on advocacy. So, what do you want to put in place this year for the first thing that you want to do, and you've already planned to do, I know, but can you share that with us?
But I think that there are plenty of action that we can already do. But I think that everyone have to do, for example, for communication and dissemination, I think that everyone has to do something. it's important to be present in the conference. Things like have a stand and that everyone will be engaged in that. If you meet someone, give the business card, speak about Remedia, be part of EN. I think that the work package with 8 is also important because there are people that are interested. It's really a strong group. The European Commission is interested in the project, and so little things like that during the year. I really encourage everyone to be part. Also, with you can think that the Twitter, LinkedIn is not important, but it can have you can reach people with that if everyone do something. We are, I don't know, 60 person in the consortium. If everyone, it's a big network. So.
Thanks. And yes, please all. Now you know Roberta who joined us, and so be sure that you send her all your news and questions about how to disseminate your results or your probably coming results. But it's really important that we act as a project, and doing this kind of activities is really important for us.
Not only your results, don't wait for your results, but if you do something, you go in a conference, or you want to write something for the website about your activities, just what you are doing every day. It's,
Thank you, Roberta. I promise I will make a Twitter account just because of Remedia. I was thinking about a godfather. So, do you think about that? To disseminate the Remedia project, sometimes it could be important to have a godfather or a mascot or someone between the population that is really emblematic, you know? Like Téléthon, for example, it works well. Like the Téléthon, they always have someone representing okay, this is really far away, but in the idea it's interesting. Yeah. So I don't know.
Yeah. Like if you think, if you have ideas, everything is really welcome.
Thank you, Roberta. Just my feelings as a work package leader. In fact, we all have, let's say, commitments, things to do for the project. Like some are doing chemistry, some are doing engineering development, some are doing epidemiology, some are doing bibliography, whatever. And it's hard to, to implement, let's say, this advocacy if we are not sticking to, for me, a plan. If it's a priority, we can, if we have a plan and that we are talking of the plan all together, sometimes, I will be a soldier if I know that I have this action to complete. For example, in the case of the extra budget, we discover that there is an extra budget available, then immediately everybody found time to discuss about the extra budgets, create proposal and so on, because in the mind of several people it was a priority and the time to discuss this extra budget. And of course, right now I'm talking of my experience, this is not my priority because I'm not sticking to a plan. If there is, for example, one or two executive committee with a plan, discussion of people of what we will do within 2 months, 3 months, what we will have to do. I think it's better to to put that in your list of action. And if, for example, we have an executive committee on that subject and nobody connects, it's also a sign that we have to plan something. And for me, this is my feeling. It's not in my, let's say, priority. So I need somebody to manage and to affect actions to people, even if sometimes it's hard, because then you have to think to the things, because you know that you have something to do, to give or whatever. But many other people may share their experience and say no, but for me it's okay. I will contribute with no problem. I have ideas and so on. But, Ralph, maybe you have some.
I think it is important, and you play also this role when you go to a meeting or whatever, you just remember to send an abstract or about Remedia. It just, sometimes you may think that you don't have enough results, as you say, but it just to make the Remedias known in your area. I think it is important. It's not that difficult, and just you are here to help. Of course, everybody.
Yes.
Yes, I think this working package is actually a good opportunity also to work more within the EN. Because, well, I'm in Longitudes also, and they do a lot of stuff, and I'm sure they would be happy to mutualize the efforts between the two working package, and maybe Athlete as well. Athlete also have behind the big communication office of IS Global, they do a lot of things. So I think that within EHEN, there is something that can be here exploited. And also, I don't know how important is it, but if you follow all the researcher in Remedia and also retweet, even when it's not related to Remedia, but that can give also some visibility, and also in LinkedIn. I know that other projects do, and I think that
It's what we are doing.
Yeah.
But beta technology, yesterday I spoke about beta technology. Beta technology is with Longitudes, and we exchange a lot. And if we will have the spare budget, they will be with us. So, and it's them that will do the policy workshop for us. So. Okay, thank you.
And to continue on your comment, Benedict, I guess that it's true that people like beta technology will help us, but there's a real need from you as individuals to participate to this goal. So because with no will of you as individual partners in Remedia, there won't be anything done because we can't move mountains. So we really need you as all the people in Remedia. I mean, World Package leaders, of course, but also all participants to Remedia needs to be active and included in that thing. And I keep in mind your idea, Patrice, about having a dedicated ExCom for the specific questions. It can be something to to add in the agenda. So I'm going to talk about actually the last work package beside WP9, which is the ethics or the ethics requirement for Remedia, so which is the European Human Exposure Network Activities work package. So that's, as you recall, that's a work package that has been added after we were granted with the project. Because it was mandatory in the call that all the 9 projects that have been granted have common activities, and this is something that EC is really keen on having developed. So the WP8 objectives are as global is so to establish a European Human Exposure Network, which has been launched 2 years ago now in Brussels. So the initial objectives were to set up an external network advisory board. We've done that. Review a common EN communication and dissemination strategy. This is an ongoing process, as there's a lot of activity there. We still need to put an effort on registration of Remedia partners into EHN working groups. I will come back to that later, and also to update the website. So the first the achievement for this period of time since the last Remedia Consortium meeting, well, the projects had changed, well, the EHN work package has changed of hands since it's now Athlete on Equal Life. Just a reminder that we will be in charge with E4 and I can't remember the name of the third project, but we will be a trio at the very end of the consortium meeting for the last 15 months. So we've got still time, but we will have a lot to do at that time. So there's been a collaboration agreement signed and periodic year-end board meetings attended. The second task was to set up an external network advisory board. And so we were in charge to mandate the NAP. So we had recruited 5 network advisory board members. So this is an ongoing process. And then we've got, well, internal meetings for organizational matters with EHN, but we had also different events open to either general public, or only EHN members. So we got here in a session at the EU Green Week in last June. That was an online event. There was also a HEAN conference, which was open to public, if I recall correctly, in June. There's been also a share with other projects, and maybe we can think of that, organize something like that for Remedia, but like EXIM's organized a symposium on exposure minimum interactions on June, also last June. So maybe we could think of a symposium to organize all together and to invite other people from here. That's something to think of. And we've already sent you some announcements, and Roberta did it. In May, there will be the second HEAN scientific conference. That will be for 1.5 days. It's going to be an hybrid thing. So both online but also in person in Barcelona. So we are contributing to setting up the scientific program. There are 4 or 5 projects that are in the scientific committee. And so there's abstract submission, which deadline is March 21st. So please send your abstract. We will send you again the email so for you to know where to send the abstract and send your data. But so abstract submission can cover any aspects of the EN project, from methods to design, result translation. So don't hesitate to send something in the name of Remedia. And we put an accent on junior researchers, which are particularly encouraged to submit. So there will be a few keynotes, but also several breakout sessions, which will be organized depending on the abstract received. So please send your work to this conference. I don't know, the in-person online, I don't know if they have decided yet if there's a cutoff on the number of persons that will be authorized to come to Barcelona because of COVID issues, but at least there will be an online option. Another task that is quite active and taking more and more activity in WP8 is the joint strategy for communication and dissemination and linking to policy, which is also linked to what Roberta just said. So there's, we have finalized as Remedia, E4, and again, I can't remember the name of the third project, but we've finalized joint communication and dissemination strategy. Actually, we were hoping it has been finalized because we submitted it as a deliverable in September, but then EC is not really happy with what we've done because it believe is not as specific as it should be. So we will have a discussion with EC members and project officers early April to discuss where they really want us to go, to be more specific, more, if not active, but at least really say what we want to do and be more precise. So that's an ongoing issue. We've published in August the profile paper of Remedia. So we were one of the first members of EN to publish. I believe there's now 6 papers out, so there's 3 missing. But for those who have been published, that's a real good opportunity to see, to have a general overview of each individual project. So that's something interesting. I believe Roberta or Christina have the papers in the Remedia website, or at least they can be in the intranet of Remedia website. That could be a good thing to put them here so that we have all access to them. And then an important issue is the joint working groups. As of now, there are 3 main working groups that have been launched. One on communication and dissemination, where Roberta is very active. One on ethics, where Laurent Nidam has signed in. I don't know, I have no feedback from Laurent about that, but we need to check on that. And also a working group of on fair metadata catalog and data access infrastructure, where Etienne and Mathieu Ortala from Caduceo are in. So these working groups are really important to make HEN live, and I really encourage you to join them, to be part of this network. So the metadata working group, so we are more and more active here, since there's now, because there's subgroups in this metadata working group. There are omics data, where there's somebody from WP4. We still need somebody, if possible, to join for the subgroup on chemical exposome. But I'm not sure who could be, which partner could be interested and have interest in joining this group, but that could be something to add to your task. There's the medical and clinical data sub-working group, so Pascal has joined it, and the metadata catalog with also Pascal and another researcher from WP4. There are currently a report regarding the survey and the exposome data analysis toolbox. So, and Roberta is participating to this big toolbox. How do you say? Yeah. The building of this toolbox, that was what I was thinking of. So the idea is to be able to show to the whole network the different items in the individual project toolbox. So the toolbox, our toolbox won't be on the HEN website, but access to our toolbox will be. And so right now there's a big inventory of all the tools that each individual project wants to develop. And we're working on how to present that and to make it accessible to all. So this is part, yes, of also the communication and dissemination working group to set up a virtual toolbox. So which will be a searchable database, and by selecting the different characteristics that you want to interrogate, we will be able to select the tools that are relevant to your question. And so to make echo to what Roberta was just showing you, there's also ongoing HEN stakeholder inventory, which will be a tool to help us map the network stakeholder and coordinate our action towards stakeholders. So there will be a workshop about how to engage, approach stakeholders during the meeting in Barcelona in May. So this is really the philosophy of HEN and of this network is really to have joint actions, common actions, so that there's more than 9 individual projects. There's a big emphasis on what can be reached with the power of 9 individual projects. So in the communication and dissemination working group, there was a first newsletter that has been issued in September 2021. Hopefully you've all received it. And another one should be issued by end of March 2022, so in a few days. And also, I believe that's beta technology. They edit a slide deck to showcase EN and its constituent project. So that's all what you need to know about EN in terms if you want to communicate about the network. So it comes from, well, this is, I just pick up a few slides on the website, a slide deck. But everybody has access to it. And so it, for example, summarize the big figures of EN, number of research group, countries, number of projects, and million of euros from the EC. The different localization of the countries that we are that are in the project. Here, up here, that's us with Norway, and we are just here, down in Greece. Here, sorry, so we also give a small summary of each individual project, and then, of course, link to the individual project website. And also this slide deck gives you the little major figures about which individual items are collected from external exposures, internal exposure, and so on. So this is really a tool that you can use if you want to show the EN activities and what does it do, and again you can go to the EN website where there's a whole bunch of information. So last thing, reminder about the next step, and the really soon next step is the scientific conference. So please submit an abstract by March 21st, and specifically junior researchers are really encouraged to submit. So I'm done for WP8. If you have any questions, please ask. No questions? Okay, so now it's time for individual work package thing. There will be WP3 in room 110. Okay, 110. And so the discussion between WP256 remains here.
And I don't know if we have people following us on YouTube, but if we could maybe do the discussion over there so that they can be able to follow, maybe set a panel up there and using the microphones.
Okay.
And then at 11 o'clock we all meet outside for a group photo and coffee break.
A question, how the work package session open to other member, or
Yeah, sure.
Because for example, for the very before we have splitter meetings the 2 next days, so just
No, of course. But that's just a question of what you're willing to, what you're interested in, if it's more WP3 or 256. But of course, you're not supposed to be outside in the sun.
what if your interest is both?
You send a microphone, you send a spy, and
I propose that everyone gather around here because it's not, we don't have a huge round table. So please come closer. It looks like a focus group or something very new age, I guess. With the, I don't know in English, the anonym alcoholics, maybe. Okay, so this is an open discussion regarding the articulation between work package 256. So actually, we have different topics. A first topic would be a discussion, as we said yesterday, with Ariel regarding the work package 6 preliminary findings, and 5 as well. So I guess it's one topic. Another one would be to discuss all together regarding the statistical analysis which are upcoming because of we hope the availability of data for ALSPAC and the Scandinavian cohorts, something that we have now in view, and I guess also for Vaincre la muco, but Ralph is in another session. So I think those are the two main topics. So I don't know, I don't have any particular order. Maybe we can discuss the second topic I introduced first, and then we can move on with Ariel and dedicate the rest of the session to the preliminary findings. So, and we also have I see Stefan, but a discussion regarding the analysis. I was talking of the cohorts for the clinical part, but of course we can, as a perspective, we can also discuss the omics analysis and how it would be done. Okay, so for the different cohorts, I will start. So for the ALSPAC, cohort, we drafted a statistical analysis plan, which is based on different kinds of analysis. The first one is very descriptive and I would say unsupervised. By that I mean that we, in the first step, of course, we will make a clear inventory of the data at hand, because we have the theoretical missing data rates, but we don't know the reality yet. So first we will have to make a clear inventory of that. It will take some time to check those, but the clear step after that is to launch the clustering analysis, to be able to identify specific clusters. So we have two subparts. The first one is to re-perform a trajectory analysis to identify the lung function trajectories, because of course it's an important goal. I will say it's a relaunch because it has already been done, as I said yesterday, on different papers. But we need to confirm that we find similar findings with similar approaches, and so it's like a benchmark, and see whether we can find different things with different methods, and because the database maybe we will not analyze like it was done in the previous papers. So we launched the clustering of the trajectories, and then work on an important aspect of this analysis, which is to identify clusters of exposome components by assessing a wide variety, in fact, of exposome components, from the in-house environment, the individual risk factors, and more distant environment exposures, to see whether we have some correlations between those. We know there are, because of course, for instance, socioeconomic factors closely correlate with a lot of environment and health-related behaviors factors. So it's a known fact, but we need to put that in motion to identify clusters, and it will be, I think, an important finding. So to do that, me and my postdoc in my team, so Michel, we are on board, but of course the project is collaborative. So anyone interested in this cohort in the fields, of course, we will discuss that, but it's open. So for the LSPAC, descriptive, unsupervised analysis, we can also, of course, whenever we have identified clusters, we will add some predictive modeling to simplify the description of the cluster first, by identifying the most important predictors of the clusters, to say that cluster 1 is like that, and we can allocate someone to this cluster because of a simplified list of key factors. It's something that can be done. We don't have specifically an objective to build predictive models themselves, but it's sometimes that within the project we have in mind, it's within the objectives of the work package 5. So for LSPAC it's possible as well. We can also, for instance, I give an example, determine a key phenotype at adulthood, so 24 years old, and we want to predict that. So we can build a predictive model using regression or machine learning techniques. But it will be at a later stage. First we need to understand the data, to work on the clusters, and then the predictive models will come. So this is for LSPAC, yes?
I have a question about the determinant parameter that will be leading to the cluster constitution. we talk about trajectories of health and trajectories of disease. So you said that you will examine the phenotype of a disease at a given moment in life, but do you also explore the evolution of the disease? That means if the phenotype may be different from the earliest stages of life or disease, but is there a way to see how the degradation of the state of the patient? So how can you differentiate between the state and the evolution?
Yes, it's a key question and key issue. For the lung function parameters, we can already work with a dynamic framework. So when we are talking of trajectories, it clearly means we can model the evolution of the lung parameters because it's not that complicated. We have a curve or something like that, and we have not that many time points.
You have standard curves.
Start.
You have standard curves, and you see if it goes beyond or...
No, without standardizing, it's just observing what you have, and then you from the data you identify key trajectories. For instance, those who have I don't know, a linear increase or with a plateau, I don't know, very high, those in the middle, and those we are lower, and maybe with some variations, I don't know. But so it's for the lung function parameters. For all the other aspects of the phenotype, for instance, symptoms, wheezing, things like that, and the other diseases associated, and the exposome components themselves. So it's a lot of information. There are several possibilities. So we can perform some kind of clustering, static clustering at samples. So it's something I think we will be doing because it helps to understand the data. And doing so, you can then, when you have your clusters at, for instance, 8 years old, 15 and 24, you can make bridges between the clusters. For those subjects that we have followed up to the end, we can see if there are some changes, or it's quite pretty for the figures because you can do some arrows to see that those clusters have remained the same and those have evolved toward this direction. It's possible to assess the different moves between the clusters. So we have different possibilities, but clearly it's an issue, it's more complicated than doing a clustering at one point and that's it, and then you just check the prognosis to see, identify 5 clusters of patients, and then the cluster 1 is with the worst prognosis because we know that the mortality is like that, or the evolution of the disease is like that, so we can do. So it will be a sequence because there are a lot of possibilities, and clustering, because it's exploratory, it's very iterative, so it's not one analysis, I click on the button and then it's done. It's a lot of, sometimes it's quite frustrating because you never end. You want to assess, you find something, you discover another relationship, you want to go deeper, you remove some factors. So it will be a sequence, carefully done by adding things sequentially. Not everything at once because we don't understand everything. Yes. No, I'm not sure to understand. Yes, okay. I understand. Yes, it's Yes, so it will be done at the initial stage to split the different variables between two kinds. So those which help to construct the clusters, so which are under consideration for the clusters or the trajectories, if you will, and then those with an illustrative goal. So it means that it's after the construction of the clusters. You can see this trajectory, this cluster is associated with whatever you want. It's just descriptive. So it's the main.
No, I have just 2 questions to Amen. So when you are talking about clusters, at first I was thinking you were talking about clusters of exposures, but you are talking about cluster of patients as well, the two. And I think one thing it's also important to define, at least for ALSPAC and Pelagie, and all for one side and the adults on the other side, is when you want to do the cluster exposure, at what time in their life. Because I think an opportunity we have with Pelagie and ALSPAC is to look at very early exposures, and that I think is something we should try to exploit as well, and not cross-sectionally, but really looking at exposures before we assess the phenotypes. I don't know if you have thought about that already or not, and what's the strategy. And well, one thing we have also is we don't have so much power in Pelagie, so maybe we will have to do the clusters of exposure, etc. So maybe we'll have to adapt, taking into account that we won't have so much participants.
Regarding the first part of the question, yes, no, it's a clustering of the exposure. So maybe by discussing, I was talking about the phenotypes of the disease, but it's the idea is to consider that as an illustrative feature. So we start from the exposure, and then we see if we find associations with those clusters and the manifestation of the disease, or the disease. At the beginning, there are no patients, those are subjects with different problems or not. But we will do the clustering of the trajectories of the lung function, the clustering of the exposure, and see whether we can find an association between the symptoms, the trajectories, and the cluster of exposure. Of course, it's tentative to do it the way around, because it's something that we do sometimes to start also from the disease or the clinical manifestations and see the exposures associated. It's not forbidden. It's the conceptual framework that we need to state at first, but it can be changed. Regarding the second part of the time, yes. I think the idea is to start by the exposure at birth, because we start then to link that with the trajectories of lung function. But we will do it at several stages, so we can do the same just to see if it's robust. If we find similar cluster of exposures using different time points, it means that it's kind of robust. People don't move that much, and maybe we can say that we have found typical clusters of exposures. And then we can do the things with the different arrows and the modification, maybe to see if it changed. But the idea is to start at birth and then go on. Mm-hmm.
I
I think right now we are discussing more or less analysis strategy, but I think we need maybe to take a step or two backwards and start also to discuss how do we define the exposome, which variables do we want to include in our analysis. And also, I think in this project it's important we have very different cohorts, that we also think in how do we combine. We want to have results so that we can say in pregnancy we see this, in childhood we see this, and we see this in older ages. So I think what is important before we kind of start all this analysis strategy, we have to define what is the exposome in our opinion, which variables do we want to include, because I think it's important that we somehow harmonize. I agree that it's not possible to completely harmonize, but I think it is important that at least we, before starting, have some ideas of what we want to add in, so that we don't add something in that the other cohorts, for example, don't have, and we maybe don't find that relevant. So I think it's important that we start by having a discussion on the definition of the exposome in our project. What do we want to look at? And then we can do the analysis strategy. And also not only look at each, of course it's important to look at each, what do we want to do with each cohort separately, but more look at it, what do we want to do with the cohorts in this study combined. And also another thing I was considering was, it seems that there are already some exposure available in the cohorts. We have air pollution, it seems Etienne also have some air pollution, and also because as we discussed, Etienne and I already have data to start doing analysis, but these analyses will then be made on air pollution, estimated based on different exposure assessments. So I'm just not sure how to continue from here, because it's of course also important what do we get when we use the same exposure assessment also. So that just some of my thoughts.
Thank you. I completely agree. I was in the general sequence, but clearly the descriptive analysis is also for us to help us, because there are a lot of variables. Even after the inventory of the ISPAC catalog, it's complicated to have a clear view. So the idea was to draw some big families of categories by subgroups of exposure, starting, for example, from the health-related behaviors at the individual level. What do we have in terms of physical activity, diet, and things like that? What is the granularity of this information in the different cohorts? Are we able to find indeed some common denominators, or common definitions? And then determine, so it's something that we already always do in cluster analysis. We start with the database that we have, we define some categories that we need to represent in the clustering, and then we choose to find some kind of balance regarding what we want to be able to identify as key patterns between the data. So this is something that we need to do and make this inventory of so it's also possible to have two possibilities. For instance, a common view with a degraded information, so to be able to make common analysis between the different cohorts. But maybe it's a proposal to leave some room for more detailed analysis, because some cohorts have some key strengths. I guess it will be a shame not to use them in details, even though the other cohorts don't have specific information. Maybe we can also, of course, have two ways: a detailed one and a if it makes sense. I don't know what.
But maybe a simple start would be to start looking at the data that the different cohorts have. So maybe we could make a very short few people in a working group, one from each cohort, just doing a list. I think all of us have access to cohort data already, so we can start looking at the distribution of house smokers, non-smokers. I think this is important knowledge for us to be able to continue with the actual analysis, because I really think it's important that we somehow harmonize. I agree, of course, we have noise in our population, maybe the other cohorts don't have that. Of course, we should include that, and I'm sure the other cohorts have other parts of the exposome that we don't have. So of course, but I think if we talk about lifestyle, for example, it would be great to have an idea of what in the lifestyle do we want to capture in this study. And then there's also the exposure discussion. Which do we wait to have the actual exposures estimated, or do we start with what we already have? For example, we have ultrafine particles in our population, so it would be kind of a shame not to use that. So also I think we have to consider how we do this.
Yes, so also from a more political point of view, I think that maybe you can sell the harmonization data instead of the common database, you know, for the EU, to make a catalog of harmonized data. They do that in other working packages, in other so I think that can be also for the EU to say that we could not do a common data set, but at least we have common variables defined in the same way in adult cohorts and in, well, because I think in adult cohorts in one way and in the children cohorts in another way.
Yeah, I completely agree. I'm coordinating the Nordic project where we have these Excel sheets that all cohorts fill in, and it's kind of it's very easy, and I think it's a good way to do this, how we define it. So of course, I'm sure everybody have seen these, but I think that is an important place to start. Also, I think this also helps. For example, you may have an idea of what is in the exposome that we actually have in our data, but I never considered could be part of the exposome. So I also think it's an important part of actually developing what we see as the exposome. So I recommend to start to do these Excel sheets with the information also on maybe on the distribution already of some of the variables.
I completely agree. No, it's, I pretty much like this point because it can be provided as a deliverable. It's, of course, it's not a common data set, but common rules in the context of the respiratory diseases. So it's interesting, and I love the idea. Excel sheets with categories and colors. See what we have.
The key point here is to the Excel sheet say how to define each variable, and then each cohort will say we cannot, and if we can, we have the same variable, and if we cannot, we have this that is similar or not. You know, but because, for example, it's smoking, and it defined in so many ways. So it's nice to have the same definition for smoking, and from ex-never current to 5 years, and to be sure you are defining in the
same way. Also, passive smoking can be defined in several ways as well. So have clear definition for each one of the variables, and not all cohorts will be able to fulfill the criteria, but at least you know, and you know if you have similar variables that can be used or not. And so we can also propose analysis with only common variables, and then sensitivity analysis, extra analysis with better defined variables in the cohorts where you have better defined variables.
And just to, regarding the clustering analysis, is something that can be done. For instance, the clustering is done using the standardized definitions, and then the description, the detailed description of the clusters found can use the more detailed information, if any, in a given cohort. So we have a common definition and vocabulary at the start, but then we can go further with the details. So, okay.
But as you have spent so many time in ASPA catalog, I think you have a good place to start.
Yes, but my brain is full of full of so many things that the 5,000 and more variables. But indeed, there are in some cases it's so much detailed that it's something that I know we won't be using. So something more simpler is good.
I think yes, it's a good idea to start with basic variables so that we know we will be using, and then we can see if we extend to others, but that's the traditional common variables.
And we can organize that using the classical framework for the health determinants, starting from the individual and even the internal exposome, and going out towards the external environment to list the different aspects and what is available or not. Okay. Yes.
Have you investigated the opportunity to explore the SNDS database with the ambulatory and hospital resource consumption of people, because it could be an interest to track the trajectory of the patients after the diagnostic of COPD and CF and before the diagnostic, maybe up to the birth.
So regarding the SNDS, so it's the national claims registry and the big medical administrative data set in France. For the French part, we have the CF registry, so we initiated some discussions with some experts using the use of the SNDS with vancrelamicoviscidose and those potential partners, and it was not very, we decided not to go further because it was too complicated, too long, because the administrative procedures are always horrible. I have the same experience at the hospital level, and to use the SNDS and to do the linkage with clinical cohorts. So in the framework of Remedia and the 5 years, which are already quite consumed, we find it not feasible. So for the vancrelamico, for the Pélagie cohort, and
No, we won't do it. It's too complicated, and also now to access the data of the SNDS, you have to pay to the CAC, that is quite expensive. It's not budgeted. So for now, Pélagie at least won't be linked to SNDS data.
I think that for INSERM it's free. Usually, no, it's not free for INSERM.
No.
But there are in the rules of the SNDS, there are special access for public organism.
Yes, so the access is free, but not. You have to pay what they call the sales de boîtier, and the sales de boîtier depends on the number of. There is several packages, including more or less memory, etc., and that has a cost because you have to rent the server, you have to rent the boîtier to access the data, and so that's not for free, because you have to pay for it.
Okay. But usually in terms of duration, most of the time, according to our experience, it takes 1 year for administrative request, and so 1 year. So 1 year in the frame of 5 years, maybe it's not totally impossible, no?
It's no more 5 years.
Yeah, no more 5 years.
Less than 3. We can't wait.
Yes, and the benefits from that, there is a potential benefit, but it's unclear to me. For instance, for the CF registry, we have a lot of information on the healthcare consumption already in the registry, because the database is very comprehensive for those aspects. So it's a lot of work for unclear benefit. For COPD, it's already it's not in France, because we don't have here data for COPD, so no SMBS.
Sorry to continue with this, but I think it's important that we have a person dedicated to, as I say, collect the data for each of the cohort to be able to do this harmonization. And I think, I don't know, is there a postdoc associated to this that could be dedicated to actually get this data? Because I think we can all deliver, but it seems that there's a person that is actually driving this acquisition of data missing right now. So it's just, is there a person, postdoc, PhD student, attached to Remedia, which could be the person leading this acquisition of data from the cohorts, or information on what is in the cohorts? Because otherwise it won't happen.
Can you ask her if she can hear us when we don't use the mic, just to have more freedom for the speech? We can talk loud, but because it's quite unnatural to give the mic at.
No, but that's for sure. Each cohort has to feel for their own cohort, but we need this
the template.
Yes, because Meta was proposing someone in charge of, if I really understand, as a coordinator and maybe to grab the information.
Because we need a template at least to fill in, and we need a person that collects these templates, compare these templates, see this cohort as this, so we need somebody with the overview of course, the cohorts themselves. I was removed from my cohort, but I need to know what to fill in.
Okay. Yes, just to summarize, so the question is, we need a template, so we can work on that with Michel. We need to gather and collect the different variables dictionaries to see what's in each cohort. And then the proposal from Meta was that the same person can make the proposal of the harmonization based on those dictionaries. Yes?
At least.
At least we need someone to summarize and have the overview of how because we need kind of a common definition on the exposome that we can start. I think it could be really interesting that all cohorts do a primary analysis including the same variables, and we can of course expand to do what our cohort is best suited to, but I think at least because as I see this project, the unique feature is that we have different courses of life, and I also think this is the important part. But if we do analysis on different parts of the exposome in the different studies, we will never do any conclusions based on all the cohorts. So at least this person has to give us an overview of the primary analysis where we all have basically the same variables included. And as some of the cohorts are already basically ready to start, I think it's kind of, it needs to be something that we proceed with now. Also, Sophie wants us to publish really soon, and to be able to do that, we need to have this list.
Just to conclude, maybe. No, I agree on the principle. I'm just thinking about the human resources to do that and the order of things. I was just thinking.
No, I was thinking that as finally we don't have a common data set, and if we want to define the exposome clusters in the same way in all the cohort, that would be nice, because it would be the difference with Remedia and the other projects individually or common. It would be, yes, the harmonization is very important, because the idea is you will do the codes and you will send us the codes we will apply, because as you won't have our data or something like that. So that's a more important step, to have a harmonization. So we all call the variables in the same way when we do the Remedia analysis, because we could in that way share the codes. Our codes would be best for us.
It's not that I'm suggesting that you are doing all the job. It's just, as I said, I think we should set down a working group, maybe already today, with one person from each of the cohorts, and then maybe, I don't know if your postdoc is the correct person, but we need someone who is sending us the mails, reminding us to fill in the Excel sheet. We need somebody to construct the Excel sheet, and when we have the Excel sheet from all of the cohorts, I think we in this working group should together consider which variables to include in the analysis. So it's not like everything is supposed to be on you, Etienne, at all, but we just need a person coordinating this to make it happen.
No, I understood. I was not thinking about me. I was just thinking about Michel. I don't know if Michel is listening or not. Because she's not full-time for the moment right now on media. But there are alternatives as well. I don't know on your end, do you have PhD or postdoc under recruitment, or who will be in your cohorts the contact person to be part of the working group? Do you have an idea? Or?
I think I will start.
Okay.
I think it makes. I think it should be the person who's with most experience right now in this group, because we need to take some general discussions. So I think it should be the PI of the cohort right now. But the person collecting the data don't need to know each of the cohorts. But I think the working group should be the PI, because it will be some very general discussions.
Okay, so okay. So my proposal is to I will see with Michelle if she is okay to fulfill that role, because just to check with our agenda, I propose to be part of the working group also, because at the moment I have a clear view of the Alspec catalog. Submitter for the DCH. Is Tony, she's not here. Sorry, Tony, because I'm in the middle. I can't. So Tony, of course, for the Novak and Tromsø cohort. Benedict, I don't know, between you and Charlene.
No, I guess I will read the contact, but
yes.
I work with Charlene. So
of course.
For Pelagie, as you know, Pelagie is in other European projects, not only every other, so they have already done a lot of harmonization data. So it would be nice that we don't have to create specific what we already have, so maybe we can share a bit. I don't know, I will have to check with Charlene how much we can share with other projects, the harmonization data that has already been done, to not do the same work in a different way twice.
Yes, if she has also already templates or tools with a format that has already proved useful, it will be helpful as well. Okay.
I have a question for you too, actually. How, because I'm stupid, I don't know how things are done, but how would you integrate your data, the environmental data, or how would you have access to the data that are already inside, have been collected inside the cohorts, or will you generate new data by searching the different bases and so on? How would it work, and how would it be organized, harmonized with the clinical data from the cohorts?
Well, what I been understanding is that we will have to give our data to an intermediate that will be gathering data from the cohorts and then gathering our data to match them. And then we may have some access to not complete data if we want to do the analysis we planned. That means finding the most consistent information and the most consistent degree of synthesis for the data or the indicators we planned. So that's what we'll be doing. I'm not sure the process will be the same for each cohort, because each cohort has its own requirements, and that's how we'll be doing. We've experienced a very difficult year with Elizabeth that was not working though as fast, well, not as fast as we were expecting. So we are still at the beginning of our process with a new person that is ending her thesis while starting to do what Elizabeth had to do previously. So we know we are really late in the process, but we have hope that it gets better now. But then there will be a specific process for each cohort to connect the data, because we will not be able to match them on our own. We won't have the data to make it match. We will have to give our data to an intermediate.
Yes, so just to illustrate for the LSPAC cohort, so it's you have your information, you know that for the UK you are able to model, for instance, the noise or whatever the exposure, and whenever you have your database with the different time points and the different values, it can be linked with information from the LSPAC database. But with an intermediate, which is the Pearl team, so with the procedure that we saw yesterday. Okay, so it will need to be stated in the template with some, for instance, if we say that in the DCH we have information on a given pollutant which is not available in LSPAC, but possibly through a new linkage. So it will be an added value, another result. It's something that we can push. For the Pélagie cohort, what do you think regarding the adjunct of new environmental?
We have already thought we cannot share the geocodes.
So we will have, you will send us the data and we will link with the geocodes. So we just need to be sure we are using the same projection systems and things like that. And so we will link the geocodes. What we will need is for you to give us the year, and so for the address during pregnancy, at birth, at 2, 6, 12, and for now, and then we will do the link in the in the team. Because yes, sharing the geocodes would be too complicated.
For the DCH, if there are new information?
I think we just give you the geocodes and then we give you the date of moving. And I think we can get it back to 78 and until now, so or at least until 2018. So that's my plan, just to give you the geocodes and some dates. So I think basically the only thing we're missing is a data processor agreement between us and you, and then you can actually get them. So I will get to that when I get back.
Okay. I'm sorry, Tony, because I'm in the middle. If we have some new information regarding environment, is it possible to have some geocoded information with the NOVA cohort, or maybe the Tromsø? Yes. If we, for instance, we have a pollutant, and we have some modeled information or observed from the LISA. Would it be possible to link this information with the clinical information from NOVAC or Tromsø? Because I don't remember if in Tromsø or NOVAC we have geocoded information, and then do we have access to that, or can we transfer some environmental information and do the linkage, or?
Yes, I suppose. I don't know at which level, but yeah, but we're not supposed to combine all cohorts.
No, it's not to combine the cohorts, but to provide a common vocabulary or common exposures definitions. So. I'm sorry, it's
to combine another cohort with we're not supposed to combine.
Yes, it's not the, we don't plan to combine all the data sets. So, yes, for the address, for instance. Yeah, okay. Yes, of course. Okay.
Also for discussion, we thought of pooling the Danish and the Norwegian cohort, and I have been thinking that maybe it makes most sense to pool only the data with the omics, because I think this is where we lack power. I think in the other analysis, the cohorts are maybe different and have different information. So, but at least for all where we have lipidomics and epigenetics data, we will lack power. So maybe it is here that we should focus on combining the two cohorts. But that's for discussion. We can also try to combine all of the cohort, but. Yeah, as I said, we are more or less ready to start analysis on the entire cohort, and it maybe makes sense that we will continue this already now instead of waiting for a pooled analysis.
Yes, I agree. I don't know the...
We make some.
You choose. No problem. Okay. Yes, I agree, because if data are starting to be available, we should prioritize those analyses. I don't know the time for the statistic Denmark when you want to pull DCH, or it's a lot of permission, so let's not wait. Yes. Yes. Oui, je peux que...
And I guess that's one last question.
It's really helpful, big discussion, but...
Yeah, I know. It's just regarding exposure. Could I just have a quick recap on, it's of course the air pollution. What is else the plan? I think we talked about temperature, humidity. I don't know if we talked about surrounding greenness. So could we just please have a short recap of what the plan is to add on our geocodes?
You mean extra pollution? You mean temperature, meteorology?
So I send their geocodes to you, and you enrich them with their air pollution information. What else? Do we also add surrounding greenness, temperature? I think because we are talking about the exposome, maybe only adding air pollution.
We were supposed only to add air pollution. Even meteorology was not considered, but if we have the model data, I think we have at least temperature, but it's not very precise. I don't know what we have in excess of concentrations in the model.
We have ozone, particulate matter, 2.5 and 10.
Okay. Okay, so we don't have meteorology.
We can have it, but it's not so
It's not the same model. It's not the same output. So we just have this. I don't know what it. I'm not sure that we have better data than you already have. I'm sure we don't. But I mean, in terms of temporal resolution, maybe we can have. And what we aim to do is bringing some information about the occurrence of peaks and some indicators of high pollution frequency or duration of episodes, and who would have been like an indicator of the place of living. That would have been so I don't know when and how we'll be able to do that, because at one moment we need to have like medical information to filter the most consistent indicators. If we have an indicators of peak occurrence and then it's non-related to anything, it won't be interesting. But maybe we can give a full list of indicators to be brought to the database, and then when you do clustering, it may be interesting to see it. So I think we won't be able to bring anything more because it was not planned at the beginning, but yes, but it will be common for all. We'll have the same background for all cohorts, and we can bring a higher resolution on France because we have access to a higher resolved database, not as resolved as the one you were talking about yesterday, but it's like 3, sorry. But in France, but yes.
Actually, we have street level because we also have.
Yes, you also have street level, and you have anthropogenic differentiation, which we don't have. So, yeah. Yeah, sure. But that would be interesting to compare. That would be some kind of a validation of what we propose. That would be interesting if we can have a match on your data location and the data we propose. That would be interesting because it would be a way to see if what we propose makes sense for each people.
But just as a consideration, I know that's supposed to take more time, but surrounding greenness, I think we should consider, as I've understood it, it's rather easy to do based on these satellite images. So if you are getting the geocodes for loss, I think it would be so great if you could do the surrounding greenness based on these greenness satellite, which is available for all countries. I think it's fairly easy. I didn't do it myself, but the people that did it tells me that it's really rather easy to add to the data sets. I just think it could really add something to the project, also to the surrounding greenness for all the geocodes.
Coming from satellite information?
Yeah, there are 2 different ways to do it. There's an NDVI and then there is, I can't remember the name of the other, but there are 2 different ways, and as I understand it, it's not really complicated. So it could be great if it could somehow be done centrally from when you have the goals.
Okay, we can see what we can do.
To anticipate the discussions with the work package 4, because we talked a lot about noise. There are already standardized and detailed information on noise on the DCH cohort. Of course, there is, I guess, nothing in the Pélagie or in the ALSPAC cohorts. It's not structured. And I don't know in the Norwegian cohorts if you have information on noise or not, but I was wondering, is the LISA candidate to work on that, or how would we advance on that topic for the noise?
I think Patrice is the one that has most advanced on this point, but we clearly need to have a discussion. With Patrice, I think on noise. I am doubtful about the way we can have information on noise on the cohorts, because as we discussed, noise is something that is felt, and we cannot have it by geographical information, because most of the noise is not in the geographical databases, and if we don't have the information in the cohort, some of them have, but then I'm not sure we can have a right view, a correct view of what is stressing people. So we can have it by road, plane, proximity, maybe density of the location of living, but noise is also by neighborhood, and I'm not sure we can have this information.
Just something, we really need to speak of the movie 5 and 6, but I mean, maybe just a very quick comment.
I just want to say that this is also true for air pollution. When you go inside a flat, you will also have candlelight, you will have stoves, so I don't think that it's different than for air pollution. We have other sources of noise, but we have clearly seen that road traffic noise is an increased risk factor for a number of diseases. So I don't think you can say that we don't know what stresses us if we only have access to road traffic noise. That's the same as saying for air pollution that it's only the outdoor air pollution that is causing problems. You don't have anything inside. So it's just to say that I think research has clearly shown that road traffic noise stresses us because it's associated with a number of diseases.
Yes, I do agree. Traffic noise is really important. But I was thinking about, is there supplementary stress due to the conditions of living, and maybe that can be in some situations pregnant on the pregnant is a French word. But it means the most important stuff that sometimes is a reason of stress because of the type of area.
But we also have that information, and I think that's what it. But just to briefly say, it's really difficult to estimate noise correctly. I completely agree with you there, and we can't use these noise maps that are given by END. It's just not precise enough. You can't have air pollution estimated really precisely and then noise in 5 dB categories. So either we do noise really precisely or we don't do noise. I completely agree with you there that we need to have high quality noise assessments, otherwise I think we should give it up.
Okay. And we also have proxies for the built environment, density of the population, deprivation indices. I mean, we have an array of other things. Those are proxies. We are turning around the thing, but we can work on that also. Yes. Okay, so let's move on. So to package 5 and 6. Thanks Ariel who presented to us some results. So we have to be quick, so I guess my understanding in the summary of what was discussed yesterday, if we need to check with you from the beginning the data sources and what is the most relevant for each of the different analyses. In the middle, how you analyze this, so basically questions like is it a linear relationship, is it a more complex association, that we need to model. How do we account for possible confounders, and the most important one being smoking, of course. And then interpretation at the end of the sequence. So what is your feeling about that, Ariel, or how do you see things?
Thank you, Etienne. Thank you, Etienne. So I think that concerning the link between health outcomes and risk factors in the frame of WP5, my understanding is that it would fall into task 5.1 and 5.2 under your responsibility, because you will have a whole opportunity to investigate by your techniques these different links. It's how it's explained in the work package description. Because in work package 5, the risk assessment doesn't make the link with risk factors and health outcome. This is for WP5. In 5.3 that we have shown some maps. It's just a representation of aggregated risk factors, and in order to design some colorful map after developing synthetic risk indicator. This is for WP5. For WP6, yes, we have in the frame of econometric model, we need to find a link between the health outcomes, so COPD or CS, in order to construct an econometric model. But an econometric model is always based on linear, but it's based on multilinear, so many factors linked with the health outcomes, and then we don't have it would be totally unfeasible to mix many different kind of modeling in the frame of the same formula, because it's quite a standard, the econometric model. We need to mix economic factors, risk factors, and many things in the frame of the same formula. So for econometric model, we need we have nowhere out to stay in a frame of a multilinear model. And for WP6 and for WP5, I think you will be totally free to explore any kind of link between both, because in WP5, for risk assessment, we won't explore the link. Is it okay with you?
But when we are talking about links, associations, and even causal relationships, whether it be in epidemiology or in econometric context, we need to be careful of potential bias and with conclusions adapted to those potential biases. And our feeling is that there are important aspects that we maybe were missing by simply correlating in, I don't know, the COPD mortality with another indicator and in a given country. But again, I think we need to check the data sources, because as discussed here yesterday, there are a lot of interpolated data, and sometimes we only have 3 points with with some outliers. So of course it drives the results very strongly. So those are the most important ones. But regarding the linear model, of course you can use a linear model, but you're not supposed to always follow a linear relationship. Using a linear regression model, you can have something more subtle. It's the curves that we saw yesterday. We have some V-shape or things like that. It's not linear. So I think we can maybe improve that with you, work on different possibilities, but if someone wants to intervene.
Yes, we talked about the EMEP database to be a first guess for the WP5 relationships. So you took the EMEPs. I was surprised that it was not the EMEP data that you finally used, but you had some information from another database. But in the IMEP database, then there are also concentrations, and as we discussed previously, the emission is like an indicator of the panel of sources for energy for a given country. So it has a certain relationship to concentrations, but concentrations have more, they have wider determinants. And so I think it would be better to use annual concentrations for this topic. So did you have a look at the concentrations you could get from the IMEP site? Because there would be better indicators. That's the first thing. And maybe they would give you another configuration for your analysis. And my second point was on the work package 6. It seemed that the database you have access to has a very low temporal resolution for the number of deaths, or because it's not even annual. So isn't there another database that you can have access to, so you are able to have a better view in time of what happens between concentrations and evolution of diseases? So it's just the first question about input.
Okay, so first to respond to Etienne, of course, I think there could be tons of different statistical relationships between each of risk factors and any of the health outcomes, but it's not the purpose of the task we have responsible for. The task we are responsible for in the frame of WP6 is to select indicator by indicator the one who would be candidate for the econometric model. And if we have one indicator linked with a stochastic relationship, I think it will not be a good candidate for the econometric model, just because of the condition to do the econometric model. So now, of course, we'll check if there is any innovation about dealing with the econometric model, but most of the time, econometric model, it's a linear. And I'm okay with that, because the objectives of the task is to, as we announced in the proposal, is to test if the econometric model is relevant. It's at the end, it's not relevant. It's okay with me. We won't do a powerful publication, and that's it. But the objective was not to test any kind of statistical link between each of the things. It's just to construct an econometric model, and for that we need to test the quality of a potential linear relation indicator by indicator to select the best candidate for a multilinear econometric model. We focus on econometric before, and if we have time and curiosity at the end, of course, we can explore anything, any kind of results, and we are not limited to explore any ideas, of course. Concerning the comments of Isabel, yes, we discussed during our working party the opportunity to use a concentration, and it will be very interesting to use a concentration. But in the frame of WP5, we need to compare country by country. So how can we imagine a way to allocate concentration data to one country? Because as I have seen in the published database, we have concentration by spot, and some spots are based in some countries, and some of them not, and we don't have a good allocation, good repartition of the observational spot of concentration in every country. So I have no idea how to use this concentration data, because it's very difficult to allocate this concentration to this country. And we need to compare country, not to compare spot collecting concentration data. So do you have some suggestion for that, Isabel?
I think the way
for friends online.
I think the way emissions represent air quality in a country is not better than the way an average concentration could represent exposure in the country. So even having an average concentration would be better, because at least it would give an idea of what is happening in the country. You have very low emitting country stuck in the middle of a very polluted area. And so in the north of Europe, in the Benelux area, you have a lot of issues, and also in the north of Italy, you have a lot of issues. Some of them come from emissions, but they also come from the configuration of Europe, of emissions, and of meteorology and mountains and whatever happens in those areas. And so even choosing an average concentration for urbanized area would be something that is better than emissions. So I guess most of the people from the cohorts will be concerned by this type of environment. So not taking the highest one, but taking an average would be better than emissions, in my opinion. That's a limitation due to the fact that we consider things country by country and not city by city or area per area. We could have a regional, what you do per country would also be interesting per area. So instead of having like 20 countries, you may have 100 area of interest, and to which you could associate the specificities of the country if you don't have higher resolution for economy, for instance. But I'm not very familiar with your way of proceeding, but I think we have to increase the awareness on data meaning, not data mining, data meaning, because probably there would be a different delimitation of the parameter area to be chosen. I don't know, as I mentioned yesterday, I don't know if all the data of interest have been used, so maybe we should also have a global look at the list and said what is interesting for Work Package 5 and 6 in terms of health and environment and exposome relationship, and health, exposome and economy relationship. So maybe we should have this look, and then I'm not a specialist in either your processes or the ones that Etienne aims to develop in Work Package 5, but I think we have to have an input that is scientific input and medical input and environmental input in this relationship, so they're not only statistical, because we may miss something. So for concentrations, I think there should be a solution that is to geolocate some areas, take the average, even discriminate between metropole areas instead of countries. I don't know if you have the economical information for cities, but that is an interesting point. And I don't know what is the power if we increase the number of areas.
Yes, thank you for your suggestion. So there's several issues to explore that, but of course we need to think about if we can find some solution. First, what about the spot in the border? Because European is a very small continent. Or if we have a concentration in Luxembourg, maybe according to the wind, it will impact Germany or France or Belgium or Netherlands. So it's difficult to say that the mean concentration in Luxembourg impact this country or this country. So what about the borders? And it's very difficult to think about that.
What you want to know is the exposure. You don't want to know how Luxembourg impact. That's another study. Like, what you do need is the exposure, and then the exposure is given by the concentration, and probably that it's much more relevant at urban scale. And there is a lot of European studies that have studied the air quality at urban scale, giving data for big cities, for example. Because that's true that, for example, for Italy, I remember your slide yesterday. In Italy, it's very contrasted. If you take emissions, the mean emissions are not that big, but in the northern part of Italy, it's very polluted. And so the question of the choice of the geographical area is a question. But have you the data, or I don't know?
Yeah.
But there is no problem of borders, because what you do need is the exposure.
Yes, but we also need to have the same granularity for the other risk factors. So if we choose, if you choose one city where we have a good concentration, but we don't have any others, for us it's not. We do not think like that.
Do you have the information?
No, we don't have.
At city scale, I would say.
No, we don't have. We don't have the COPD mortality at the city scale, for example. And there's a lot of things, a lot of factors we have only at the country level. And the proposal of Remedia was to compare at the country level. Of course, we can play, if we have any good idea, we are totally free to do alternative things, but at least it could be feasible. So I think we need to all think about that. And secondly, you know, I explained to you in WP5 how I'm quite reluctant with the average, because 9 plus 1 is the same than 1 plus 9. So we have totally opposite factors with exactly the same mean. So it's not very discriminant too, and we need to be sure that the average has a meaning, not a meaning. So maybe it would be good to have the distribution of the concentration. But if we have the distribution of the concentration, we need at least the same granularity for each country. And I see in the database that we have some good repartition of concentration in some countries and some very limited data from other countries.
What we have for concentrations is very homogeneous because it's from a model. So it's not the data that are most refined, but we have very homogeneous data distributed on a grid. So we can have the same resolution and exactly the same data for all. And Etienne is maybe better on this subject than me and many other people here, but epidemiology says that it's average exposure that is the most important. What we aim to see in the cohorts is that is there a higher risk if you are exposed to peaks. So the average would not be meaning the same thing if you are always on the average or if you have peaks and lows. But at the level of your spatial and temporal level of your analysis, I think average has a meaning because it's chronic exposure. So I think it would be.
Generally suppose, and it's quite well verified, that we have Gaussian distribution for the concentration, and then the median and the mean are quite similar in general.
And Isabelle, in your team, so I imagine we try to do the exercise with primary data according to the official database, but because you work a lot about that for a long time, so maybe we can use secondary data from your model. If you have some secondary data generated by your models by country, do you think we could use your data by country to feed our analysis?
Yes, it's public data. It's not from NISA. It's from Europe. It's from the NF website, so you can download them. But it's grid set, so you have to do your own average.
Yes, that's not a problem to do.
What to do is to calculate the average, the spatial average.
Yeah.
But you have all points of the country are covered at a certain resolution, and then you have the value at country level. It's just a spatial average.
But maybe we can imagine if we have a distribution, to have the distribution parameters and make the analysis not with the mean, but with each of the distribution parameters. I just think maybe it would be original, but whatever, I will need one of your support to just to track that we use the good data, and after that we can play with that, at least in the database, because we don't, we need to be sure that we use the relevant data you have in mind, because it's a lot of things in the website, and I want to be sure that we use the good one.
Your idea of distribution of concentration is interesting. Why not? You have a number of grid cells counting for one, so you have an idea also of the list of the country.
So you can add every information from every cell and every temporal information, so it makes a distribution. And so in some way you have the representativity of the distribution of exposures, and you have the total number of deaths. So if you work by country with the distribution, I didn't know if you could work with not only one data but a distributed data. Why not? But it would be interesting to test if it changes things. And if you have the capacity, I don't know, it becomes quite complex, quite a processed data parameter. But if you have the ability to weight those information with the density of population, then you have a weighted exposure. And so the number of deaths should be proportional to this weighted, the number of people concerned by the death should be proportional to this distribution in the grid cells, and then you see if it's proportional or any how related to exposure.
Okay, so for WP5, we retain that we will explore this way to use concentration at the country level, either using a mean or, if possible, the different distribution parameters. And I just need the support from you or your team to be sure that we track the same, the good data. After that, we know that. That would be okay with you? Yeah. So thank you very much. Concerning emission, I think that we should not forget total emission, because for public measures against pollution, they can act against emission. This is there is a public measure potential acting. So it's difficult to imagine public measure against concentration outside impacting the emission. So I think the emission it could be also interesting in complement, but it would be wonderful if we can use, of course.
I would say it's almost a work in itself, but it has been already addressed. For example, there is a group in Austria, the YASA group. They developed the GAILS model, and the GAILS model is able to propose scenario and calculate how the variation of emission can impact the mortality. But it's not related to a specific pathology like CF or I don't know. It's more general. But this is the idea. But I don't remember how they build it. But they use something where they are able to link this emission to the concentration. That's what we are doing with our model. But it's highly non-linear, of course. And to simplify that, I don't know how we can do, but that's a work in itself.
Yeah, so, okay, I'm aware that some initiatives have already been done, but the added value of Remedia is to find other ways to confirm or find other perspective.
Specifically focus on certain pathologies.
Yes, and to focus on COPD and CF. But, okay. Concerning the database, do you have any idea that if we could expect quality data from WP2 to perform the econometric analysis, or are we stuck in with Eurostat and WHO data and all the problems we can...
I think we're talking about medical cohort data, right? Because data from the work package 2 from the environmental side is the one that you will be getting from the models. So maybe it's what is coming from
no, because
work package 2 to
work package 2, we work on the cohorts, so we don't work on statistics at the national level, if that's the question.
Not international, we can focus on Denmark, for example, or Luxembourg, or anywhere, or France.
On national data? Yes. So the question is, I'm sorry,
Thank you, Etienne. The question is for WP6, we don't have to compare every country together. We try as exploratory, but we can. It's better to construct a good econometric model focused in Luxembourg than a very bad econometric model in every country. So we don't care about to compare countries at the econometric level. But do you think we could expect good quality data from WP2 to feed the econometric model? It could be data from medical data from COPD or CF incidence, prevalence, or mortality, or it could be any time series analysis about any risk factors or exposure or anything.
So to feed your models, you mean so the exposure part, so at the national level, and the medical data at the national level based on national statistics. So I will be talking only of what I know, but from the cohorts, of course, it's not national. So it's just a representation of a subsample with very specific eligibility criteria. So that's no use for your purpose. I think the only country where there are potentially, but not within the Remedia framework, it's at the Danish level using the registries, but those are only connected with the DCH, so you don't have national statistics on COPD mortality, for instance. You can have that, maybe.
Yeah, basically we have the entire Danish population as a cohort also, not for this study, but for another study. So we have access directly to all registries. So we do at a national level have those exposure to air pollution, whatever, traffic noise, and of course all the diseases and the also socioeconomic status variables. So yes, we already have that at a national level, but it's, you could say, not part of this study. So yeah.
So do you think that it would be possible to work together to imagine the econometric model focused on the Danish data? Should we be able to have this access?
It depends what you mean with access. I can give you air pollution distribution. I think also find mortality incidents, but it's doing actual analysis adjusted for socioeconomic variables. I don't see that, that's a bit more complicated. I think we will do the analysis at the point in time, but I don't know if we have the time to do it within the time frame of this study.
I'm sorry, because we need to stop. We already are very late. A quick summary. So for the first part, we need to make in motion a working group. We can do that very quickly regarding the template and how we will do the inventory of all this information from the different cohorts in order to standardize things. And it will be a deliverable, very interesting by itself, and of course a preliminary to do the analysis. So we talk about that very quickly. Okay. Okay, thank you. And regarding work package 5 and 6, so I don't know, but there are clearly discussions regarding the nature of the data, and something that you can work on. Yes, thank you.
We'll discuss the feasibility of using potential data to establish probability. Just explore the feasibility.
Okay. Okay, thank you everyone. It's time for the coffee break.
Vous
mais bien sûr, vous êtes peut-être face à ça. C'est clair.
Yeah, we are doing it. It's actually right. We are doing it with the regulatory measure. Okay. So, yeah. So yeah, this is coming from this ongoing European reform. Okay. They're improving the models, etc. But overall, as I told you, they gave us because the major input is the weather. Yeah, so you know that the general picture of the weather we can get them pretty well for the next 5 days. So it's a result we can get pretty well overall pollution days during the next 5 days.
Good, because when we talk about the polluted exposure or polluted source, well, we hope that subjects are close to the source, like the traffic, and they really get something.
But you will see actually even in the models, and this is what I was trying to get again, that there are also periods where you get high regional levels of pollution. For example, coffee. Germany has all quite high levels. You cannot even see the difference in the cities. And vice versa, there are periods where we get a clean air mass, and even next to the traffic, it is actually clean. So these are kind of some the issues that these models actually get pretty well. So again, if you have choices, for example, high level, it can also help you in with the kind of the choice of, you know, where figure out if we are missing something in the city. Which are kind of in the center of the city. Because people believe that this is worse. So with the sensors, we actually found that in the summer, the first area is a few kilometers from the city. And this is a place where there are no cars, no pedestrian, no full of restaurants. And in the winter, the rooms that they were clean is not in the center. The most modern example is a lot of fireplace. When they learn food, mostly for comfort, for cars, right? The idea of having a fire is very little, right? They have other things to eat. So it's such a pleasant, you can see the center, Yeah, but anyway, it's not a big deal.
Shall we start? Yes. Okay, so this is the work package 2, work package 4 plenary discussion. So to give you a little background, especially from those out of those work packages, this was a proposal to Sophie to add this session to the agenda because we had the feeling it was important to discuss of the articulation between those two work packages, because initially in the submission of the project there was a difficult timeline where the work package 2 was supposed to inform the works from the work package 4 based on data analysis, potentially new findings, which will then inform the work package 4 to conduct specific experiments. As you know, because of some delays, there is some distraction within the work package 2. Because of the delays and the actual also implementation of the project, this has changed. So now the idea is to conduct jointly some analysis in the work package 2 at the population level, so using observational cohorts, so pre-existing ones, and in the work package 4 by conducting new experiments on mice to test specific hypotheses. So this was to inform you of this change. So it's a joint analysis. So now the question, and in vitro studies, of course. Yes, I will give you the mic after the introduction. So the idea is, what could we conduct as a common analysis within the two work packages, and as a starting point, because as we have seen yesterday and today, there are specific hypotheses that can be made from the literature review on the important risk factors, important pollutants that affect respiratory function from the youth and to the adulthood period, and also for CF patients. So there are some key risk factors identified. Some of those are less studied than others in the context of the respiratory diseases. So mainly yesterday, for instance, we talked a lot about nose, but not only. So the idea was to collectively, with the work package 2 and work package 4 partners, to identify key questions that could be jointly assessed in the two work package 2. So the different possibilities include the nature of the different risk factors, for instance, noise as a starting point, but also the combinations, because as was discussed yesterday, especially after the presentation from Pascal, there is an interest in conducting more holistic analysis where we account for multiple risk factors, their combinations, so as to assess whether there are potentially moderating effect or to the contrary, potentiating effect. And that is something, I think, which is new, because most of the studies focus especially on one component, accounting for the confounding of others, but not the interaction between factors. So this could be a possibility. This is a possibility. Since we are at the beginning of this joint analysis, of course, we want to leave room to potentially new discoveries. And for instance, if in work package 2 we found something specific during the analysis, of course, we can inform the work package 4 and ask whether it's possible to test that in the experimental setting. So, of course, we keep this possibility, but right now we need some kind of first experiment. So, I think the idea was to start with maybe with noise. So with the experiments in mice, so Mette gave us some contacts, interesting contacts, with a lot of expertise and very specific and quite unique, I think, to conduct such experiments in animals, accounting for the different kinds of noise, how we can modulate the noise. Is it the background noise? How do we account, and why it is important to account for the research facility noise by itself, to remove it or to control it at least. So this is interesting. I was wondering whether it would be interesting to add right now some subgroups with additional risk factors, such as air pollutants, to consider the multiplicative or additive effects of the different components, and also whether it is analyzed on mice, on normal mice, if I may, or already with some kind of COPD model, if it exists. I'm not expert, I don't know if it exists, so yes. Maybe do someone want to intervene and to add some elements, or especially for the work?
So yes, actually there's COPD models that we're already using at our laboratory. So it's just the exposure of C57 black cyst mice to cigarette smoke for approximately like at least 3 months, and then we observe a COPD phenotype, mostly emphysematous phenotype. So yes, we've got a COPD model, and for my part, I'm mostly interested in the early exposures to the exposome at early stage of development and the development of the lamb. So, and that's my point is that we would like to have some hint from the work package 2 about what might play a role in this in the development of COPD with exposures at early stages. But I've heard that you wanted to globalize the different cohorts and to harmonize these cohorts, starting from the data that are common from each cohort. But I guess that data that will be common to this cohort will be very common data that are often explored, and we are trying to modelize things that are more, I would say, exotic. And so, could it be possible to really exchange quite often? In fact, to ask if we got new ideas, to see if you get data to explore this idea, which are more specific than what could be common in each cohort, from each cohort with the organization that you're trying to develop.
Please, can you move next to the microphone? The remote audience cannot hear you. For you guys, yes. You cannot hear. They can hear the audience.
So yes, to answer your questions, as you said, we discussed to set an organization within the work package 2 to harmonize things and harmonize the variables and the definitions and the components of the exposome that will be assessed within the different cohorts. Because all cohorts, of course, have different data collection procedures, different definitions, and the key deliverable would be to standardize those different definitions. Instead of having one unique data set, we will have a unique Excel sheet of data harmonization rules, but it's a very good idea and an interesting deliverable. So doing so, clearly, I think it's interesting and important that we inform regularly the work package 4 of this work regarding the definitions and the nature of the exposome components that we are assessing. Also the different settings and populations and target populations, because I think now you know, but Pélagie and ALSPAC, it's in the youth, so maybe it's more interesting to your question. Whereas for the Danish and Norwegian part, it's in adults, so it's a different population, of course. Having said that, it means that for the question of noise, for instance, it's not discrepancies, there are a lot of differences between the cohorts because actually we have information on noise only in the DCH cohort. For the other ones, either there is nothing or it's very simple. For instance, for the ALSPAC currently, it's self-report questionnaires on the noise, so it's interesting, but it's not the same thing, and it's a subsample. So clearly we need to inform the work package 4 of the progress of that data inventory and the analysis performed, and of course the results whenever they come. So and it's interesting if it's of course interactive in both directions. So regarding your proposal for instance, for an experiment at the beginning of life, it means that if it's about noise, we won't be able to replicate that right now in the cohorts because we don't have that information in ALSPAC and Pélagie. Yes.
If I can just add to what Clément just said, and so that W2 people know what we can model as animal model in WP4. We are presently, the main the main animal model of COPD is smoking at adult age, so we know how to do that. It's very time consuming because it's at least 3 months of every day 3-4 hours of cigarette smoke, so but it's feasible, and we could add pollution and other exposome factors, so that's something. As Clément said, we have a big focus on the early events, the long development of the mice, and then to do some individual exposures, like as of now only air pollution, but we could add noise, physical activity, whatever, and then see afterwards if it's developed COPD. And regarding CF models, yes, Selina, speaking of CF, we have 2 models of CF mice, both with genetic modifications. Either one is with deletion in the CFTR gene, which is the that's a replication of what occurs in people. Except that in these mice, there's no lung phenotype, basically. You need to have infection or some external stress to develop CF symptoms in these mice in lungs. And then we've got another the other animal model of CF is expression of a gene only in the lungs, which makes these mice having, without doing anything, they have a phenotype, a lung phenotype. So we can we can evaluate the effect of the course of a disease with external factors. We can modify the course of a disease with one model, and which can generate a lung phenotype in another model. So that's different way to view things. So I believe that with what WP2 could give us as results on the cohorts, we could adapt experimental protocols in terms, of course, of pollution, what we do at LISA, but also what we will add with Spiros chamber, and then also over external exposome components. But we have to do that back and forth, discussing back and forth with the clinical data and exposome, environmental exposome data you find in WP2.
Yes, I'm not sure how with Pelagie we can contribute, because we don't have a disease model, it's more a health model we will have with some very probably like asthma-like symptoms and things like that. So I'm not sure how we can do this.
Well, I think that working on the early life of our mice is typically how we could, see the lung function trajectories, and because we have the possibility to do the lung function analysis.
We don't have a functional pedagogy.
That's right. Yes, but with the combination of RSPAC and pedagogy, we could. Of course, we won't have the one solution for one question. We're well aware of that, but I believe that combining our efforts and really discussing, trying to add all the things together, we could achieve something. And maybe for noise, which seems really interesting, but just focus on adults, since from the clinical point of view, we will only have measures cohort to look at that properly. Maybe we can give it a try with CF models, because we don't know. We've got to keep in mind that exposome is sort of a sum of all exposures, but it's usually not evaluated, but also some completely outsiders exposures that we've never thought of and that could be interesting. So we have really to keep open-minded.
You know, it's just an idea, and maybe it's very stupid I just had now, but what about taking the problem on the other way and thinking about positive exposome and health? Maybe that's something we can think about, as we will have mainly healthy kids, and so maybe do the parallel with that.
Well, I don't know if you want to answer, because, but for sure, for example, physical activity, that could be something positive. Yeah, but with low pollution, we already do it in WP4 with, you know, what Patrick showed yesterday, Paris-like atmospheres, Beijing-like. So we already compare the different types of pollution, pollutants, concentrations. So this is something we already do and see that there's different effects, of course, on our different models, animal models. So, but we've got to structure that and really try to stick to what we find in WP2 to try to model it in WP4.
Regarding this philosophy of duplicating studies within WP2 and WP4 in parallel, of course in WP2 you are looking to the data that are available and so on, but on WP4 we need to start developments a lot in advance. For example, this full year of 2022 is devoted to this, in fact, comparing to the previous year where we made a lot of campaigns and the following ones. So I think as a project we need in such a philosophy to decide what if we can implement the same studies in parallel, because of course we are first thinking of WP2, like for example, you don't find the data about the noise for this type of population, but maybe there are a way to adapt or to find a way. But for example in WP4, if we want to apply, let's say, noise to CF or COPD models, that for example they cannot suffer, so the noise, imagine, I don't know, they pass away when we apply noise to them or whatever, we won't be able to make the study in parallel. So what is the output? Do we have to stop studying the noise because we want to do parallel studies, or on the contrary, finally we say, oh, okay, finally we do that with WP2 and try to adapt? This is something that we have to decide, because the effort to implement this type of experimentation is very intense, and I just want to have as clear as possible roadmap of what we have to implement, because of course this is for let's say a physician of the atmosphere, a big effort to implement what we have to do with mice models. So what do we think about that? Isabel is asking for the mic upstairs.
It's a difficult question, but I think there is really an interest in coupling objectives of work package 2 and 4 for some on some specific questions, and exposome is wide, and I think exposome should be a point of convergence. That means we cannot observe all exposome from the Polaris platform, and we cannot observe all the exposome from the cohorts. But we can try to see if there are some information we can converge on. Okay, that's one point. If there are parameters that we cannot observe from both approaches, I think it would be interesting that one of the work package feeds the other work package. So if we have issues with noise in the cohorts because the information on noise is not homogeneous between the different cohorts, and it is very difficult to appreciate what is the consistency of the information we have, because it's not always on the level we would have liked it to be. But I think it would be interesting that experiments of work package 4 bring information on what is the effect of noise we can observe in the experiment, so it would feed the reflection of work package 2. I think it's important that in the end of the program we have a common discussion about what we encountered in the different work packages and how it helped our reflection. So noise would be interesting to study from the experimental point of view, and then to highlight some of the findings of work package 2 if we cannot directly observe it. And reverse.
I agree. I think we don't have to feel self-limited by the possibility of actually doing in work package 4 or 2. I guess the objective is to demonstrate that we discuss this together, that we made decisions with a consensus, and this means that there is a coordinated approach. I think it's important. We have similar questions or exposures of interest. Of course, we won't be able to replicate what the other work package does because we don't have the data. I guess it's no big deal, and we can justify that. So I'm just paraphrasing what you said, but I agree completely.
We are expected on the Symposium, so if we don't go wider than what we already did, I think it will be missing.
No, I agree too. The only remark is regarding the timing, because by the end you say at the end of the program we have to, discuss comfort, but on our road we will have some expertise by the European experts, and as we experienced this last year, they will ask us regarding the WP4, why do you implement this? Why do you implement this? You see, they already were challenging us on the fact that we are simulating biomass burning aerosol. So that means something in our field that we are able to justify, but for other parameters we need some WP2 support, to say, okay, these guys are confident in the fact that this is important to test, because we will not reproduce a perfect exposome, as you say, with every parameters. That means we are doing some choices and we have to justify them.
Yes, sure. I think we have to work together to be sure that the experiment, because you don't have the agenda necessary to do a lot of experiments on other elements of the Symposium, but I think noise linked with stress and deprivation in a wide understanding is one of the things we didn't explore. We explored the physical environment, and I think we are expected to go farther than the physical environment, and that is one of the things we thought about first, and maybe we should follow it if it's the easiest non-physical parameter to non-biological parameter to explore. But I think if we don't go into this social well-being dimension, we will miss something.
the issue here is to know how relevant the human social economic environment is relevant to mice, to that of mice. So and it is the difficulty to address. But yeah.
Yes, Pascal.
I don't know, maybe it can be an idea. We can recreate, like for social environment, we can expose mice to mold or, as I showed yesterday, there has been to a different kind of fungus, which represent a damp environment where people living in low social economic if we can reproduce that kind of environment, and it's mimic human socio-economic status of, and we can correlate that with mice and human. I don't know if it's feasible or not.
Yes, this is, of course, this is very interesting for us because this is one of our motivation for participating to this project. I mean, we are not air quality providers, of air quality facility providers for the benefit of the biological community. We are very interested to try to tackle new fields, and this is for us a clear motivation, going to vulnerable population or socioeconomic factors. So I don't know how we can address this, but we are more than interested. I am answering for Spiros also, but this is for sure.
But what I believe is that, as we decided just before in WP2 to do a working group on clinical cohorts and clinical data to analyze and so on, maybe we should have to set up a working group regarding these back and forth exchanges between WP2 and 4 to decide which exposome we would like, how to modelize it in WP4, and then go back to WP2 to see which one is the most important for CF and or COPD. Otherwise, we won't go that further in the next month. And for WP4, at least we have to, there's a lot of work to do to set up new experiments and to know how to relevantly take care of new exposome components. So.
And also I think there is a reflection to make about the mechanisms, because regardless of the outcome of interest, having a poor lung function, a key question is how, for instance, noise affects the health. So we saw yesterday, and we discussed that there are some elements, some findings interesting in the cardiovascular field. Of course, I guess there are commonalities and share mechanisms, because noise leads to stress and sleep deprivation, but how it affects the lung function, how the inflammation could be different, and especially how this inflammation could interact with the COPD related inflammation. I guess maybe those are interesting questions. Maybe it's different from the inflammation in obesity, for instance, and of course it's different from a healthy subject with no inflammation. So the mechanisms assessment, I think, is also interesting, because it's something we can only partially explore using observational cohorts. We can do causal inference models, but it's not an experiment. So clearly with the animals and the experiments that you will be designing, it's a clear asset to determine what are the key mechanisms. As Pascal presented the conceptual framework I don't remember the paper, but it was very interesting with the different arrows and the different possibilities that lead to COPD. I think it's something to explore as well.
Well, in our animal models, that's something that we've got, direct outputs, like bronchoalveolar lavage, and we see the inflammatory cells and so on. And then we go further on mechanistics, on function, or also in looking at different expressions of RNA proteins and oxidative stress and inflammation. That's really two pathways that we are really focusing on a regular basis. So this will be, of course, added to what WP4 can add to WP2. But there will be a feedback to go there. This is my exercise.
In the way of doing this, it makes me think about what I'm doing in my own research. I'm doing modeling scenarios, and when you imagine a future scenario for a city, let's say low emission zone or new access to by transportation and so on, you have to imagine how you implement this in the model. And there is always the first guess that is wonderful. You want to make a beautiful scenarios, but in your model you don't have the parameters that could be changed to reproduce the scenario. So what we have to do is to focus on what we want to change in the model, and it's the theme of the scenario, and then propose a transcription in the model. And I guess that's what should be done. If anybody that is interested can, in a given time, propose something to study in the Polaris platform. So let's say we want to stress, to reproduce the effect of stress on the mice. So the effect of stress could be reproduced this way by moving the place where they are, or by isolating them or whatever. And then if there's a reference that says how it provides stress, and then we have a list of ideas, and you can imagine how you can combine them, or just take the one that is the most meaningful for you, and then we discuss of 5, 6 options, then you can select it. And that would be a way for everybody to participate, to propose a literature associated, and then for work package 4 to decide what is feasible. So there's the idea, there's literature evidence, and there's the feasibility that can be discussed on those 3 points. And everybody could participate in it. And so you can discuss the most meaningful scenarios.
Yeah, thanks. That's a very good point.
First of all, I just want to say that I think it's great that we are discussing noise, because 2 years ago at this consortium meeting, I kind of suggested that we should add noise into the animal models, and now we're already discussing it. So I just think this is really great. And this is what a study like this can do. Just to say that I think it's really an important research question to add both noise and air pollution into these animal models, because this is really what we need also within the epidemiological research area, because every time I present my data, I'm being asked, isn't this due to air pollution? Even the politicians still ask that. And we don't have the strength that the air pollution health that there's been made 1 million studies in mice on air pollution, so everybody know that air pollution is causing all these things. In animal studies, we don't have this at all, basically, for noise. So I think also for us to be wiser with regard to noise, we need these studies where we combine air pollution and noise. Also, we know that they are culinary when we go to a city, and it could be in animal studies you have the possibility to have low air pollution, high noise, and vice versa. And I think these are the questions that we can't answer from an epidemiological perspective, but we really need these animal studies to help us come a bit closer to what is actually happening.
This feed my motivation, Mette. This feed my motivation. Thank you.
And just to add, in our lab, we want to see the impact of exposome, and we don't say that, but the internal exposome plays an important role, and we want to expose male and female mice in different age for see the aging effects, and supplemented with noise and atmosphere, and we can have different things about that. And in Romedia project, we focused on COPD and cystic fibrosis, but I think different idea about concerning different exposure time can give us different information on lung function. Healthy patients, by example, can give us different information, and we can, after implement these things, to see the impact of the, I don't know, physical activities, by example, not focused on COPD and cystic fibrosis, but in wild-type mice, by example, and study different types in this.
Thank you. I guess that at some point we have to choose. Because there's a lot of ideas, which is great, but as Isabel was saying, I believe we have to anticipate how many experiments we will be able to perform until the end of the project, how many combination of exposome elements, components we will be able to address. And so the idea of Isabel of having an open box, I don't know, open for 1 month or something like that, and so everybody from every single work package or every goodwill feed, and then we set up a discussion between together, or at least WP214, and see how it is feasible and maybe, I don't know. So see you in 1 month.
Okay, so we are going to create a working group on that, and to draft the possibilities and choose from an array, or from the simplest one to the more complex, where we want to address every combinations in every stages of life, from the very simple one, and to see where we put the bar.
Yeah, what we can do from our side in my lab is just to give a basis of what we're doing right now, so that we know from where we start, and then be open on what we suggest. Then we will see if it's feasible or not, but that can be a start.
Okay. So it's a great action after 2 years. We create an intergroup.
Thanks for your comments.
A temporary intergroup. Okay. I think it's time to lunch.
Okay. No additional comments? Or?
No, I pronounce the
Not
lunch.
it's too late.
See you back at 2.
Okay, thank you everyone.
Thank you. On en parle quand même.
So now we have lunch. We will be back here at 2 o'clock, and for the different breakout sessions, please can you identify someone who will then go up and do reconstitution, in order so that every one of the others is also aware of what has been discussed in your working group.
Do we have a first overview of what we are measuring right now, or what we are targeting to measure with the biomarkers, like the hexanol, the
395 regime and the neutrophilic elastase. Do you know if you have found these things somewhere in the databases you're researching?
No,
okay.
It's impossible. What you should find there is the environmental factors.
Okay.
So what we did when we decided to start with the sensors is we looked up all the literature. What's the common, let's say, environmental pollutant factors that have an impact on these COPD and CF and these things. That's how it came in. I think what they were expecting is that, for example, your cohort, you have at least some of these pollutants in your database. Yeah? But as far as I understood until now, it's not really clear what you're looking for. The database is not a, let's say, stratified database with all the data coming from the different databases up to now.
No, it's heterogeneous databases from different cohorts, which have a very different data collection. So in some cohorts there are no environmental information whatsoever. In other ones, it's much easier. Just in the spectrum, then each cohort has a lot of information already in the database. But for Pélagie or Macron CFO district, we don't have anything. There is no environmental information. It's very different depending on the cohort. But there are common factors. PM, for instance, is a real thing that can be measured within the section database. And Lisa will work on adding new information for Pélagie, for abstract as well, and from the knowledge report. And this, I think, it will be the same kinds of pollutants.
It should be like a more or less common.
I think NOx should be in. It's very important. Particulate matter is known to be important. Black carbon, you find it not everywhere. Then volatile organic carbon, in my opinion, is important because it's somehow related also to traffic and these things, and also to industry. That's what you mostly find if you are going through environmental data.
This would be then in the end, if you look into the database or the cohort, seeing the same data we are already looking for.
That would be convenient.
We are also doing like some little research to have a good idea of what is the most likely to be looked for or to be showing up in the cohort. So I think a good estimated guess.
We should show that we have talked together and have some common ideas. I think noise is a good idea to add. Another stress factor is light. I don't know whether you have also information about that.
Disturbance has been understood.
On stress? Do we have information on stress? No, sorry.
We know that stress is a factor that helps to get ill.
Probably we don't construct something very complex in the temporary interval. We can have some
and the point is, we are not able to put everything in some set of device. Would be nice, and then I would opt for heart rate.
No, but once again, I think even for the future, I don't think we will have something that will give us. Just we will have some reference parts, and then we will have a network of data that will
we know there's a thing all together to have the global for sure. We see. And I'm sure that at Christmas everybody will go out something from Apple.
Clearly, I propose that, as I proposed in your dashboard, we will be sending the results of our weight data inventory. And for the exposures part, we will send you as well what is available so that you can see that, for instance, in CH, we clearly have PM, NO2, that means cohort we don't have anything, nothing.
Okay, yeah.
And then what we will do about that, does the LISA help to implement, to add new exposure to those cohorts with new models. And it can be interesting for you to see that it's consistent.
But there are some apps that you can try.
Okay, yeah. Very good.
Alexander, 2 points.
Yep.
One, because the sentence is already on the computer as to act for me as a reminder, you copy and paste just the sentence.
I will.
You send it to me. And the second one is personal. Clément, what is the origin? Because this is the name of my mother.
This is really interesting. This is from my father's dad. But the interesting part is he grew up at the Baltic Sea in Germany, like his whole life, and his family is also from there. And from the generation before, I have no idea. But all the generations I know about, they have always lived there in the Baltic Sea.
Yeah, because of course Clément is.
Yeah,
it's very
obviously it
French.
is. But, so it's actually a really interesting question. I've never done any research in that direction, but somehow it must have gotten there.
Maybe we are cozy.
Maybe.
For sure we have a common ancestor. Somewhere.
Yeah.
Yes, my mother is Lucienne Clément. We imagine all French.
Very much, yes.
Moi je suis très très bavard, j'ai rien à dire, je peux parler des heures, il faut tenir des heures une salle sans sujet, je suis bien. Un sujet imposé, celui-là, oh voilà, c'est parti.
Bon,
moi, pour ça, j'ai un peu de soucis dans le fond. Voilà. On regarde ce qu'on fait, est-ce qu'on essaie de rentrer ce que je comprends.
Moi, je voudrais bien. Ouais, je pense qu'on va t'attendre.
Schönes Matras. Ja. Wir waren ja doch sehr doch. Echt? Wir waren auch mal gut, aber mehr. Ah, so.
Parce qu'il y
Yeah. Yeah, they want to see the data.
Welcome back, everybody. Now, we're almost done for this consortium meeting. Etienne, you want to, I guess WP2 is first, as 2 is before 3, so I don't know if you want to.
Thank you, Sophie. So for the wrap-up of our session this morning, so it was for the work package 2, 5 and 6. So we had fruitful discussions, interesting ones, and regarding the different analysis that we want to perform on the different cohorts. And we, as a quick summary, we decided upon creating a small working group to work on the standardization of the different data sets, so as to have a common dictionary and common definitions for the main exposures of interest. So we briefly spoke about that at the previous talk. The idea is to conduct analysis with a common dictionary and between the different cohorts whenever possible. Of course, we will have some limitations depending on the cohort, but based upon those common definitions, it will be easier to compare the results, and it will be used also as a deliverable for the CE. Because it's interesting, important, and useful for subsequent analysis. So we will start this working group very shortly because the data are about to arrive, so as to initiate the analysis rapidly. The second part of the discussion was focused more on the articulation between our package 2 and 5 and 6 with Ariel. So we discussed the results from yesterday and agreed upon working together on the data quality and the input of the different data sources and what is the most interesting, relevant, what are the potential pitfalls for using each data source, and how it can be done. So we now have some ongoing discussions on how to do that. And we discussed also the different analyses. And I think we also discussed the possibility or not of performing some more focused econometric analysis on specific countries, but it's a reflection. I don't know if the members of the discussion want to add anything to this very brief wrap-up. No? Ah.
Yes, a little bit more details about WP5 and WP6, so we agree to investigate taking into account concentration pollutant instead of only emission. So we will try to do that with the help of the team of Isabel. And for WP6, we are in touch with our colleague from Denmark and try to leverage how we could have a high quality data focus on the particular registry of Denmark. So this is a way of thinking. I think we'll have a much more quality data in this way.
That's it.
Thank you. So some working group to organize. You didn't talk about WP2 and 4 discussion. Maybe that's time also or not? That's right. Forget about that. Yeah. Sorry. I'm tired, I guess. Alexander, you want to? Oh, sure. Okay.
Yes, we were discussing the design or the draft of the design we had for the study for the COPD and CF patients, and also a bit more in general what we actually need and want to achieve with these studies. As one of the elementary benefits, or it's actually something we have as a duty, is to validate the sensor device we are developing, and therefore we need data to put into the device and to see if we compare these data then with the ELISA assays, for example, the gold standard, then we can see is the device working as supposed to, and then the next step, see what can we get from like real patient data.
Yeah, and we discussed a lot with Ralph about what is possible with the CF patients and what is possible with the COPD patients, and we agreed that the environmental exposure in the real world will be possible for both study sites, that we can do it over 2 weeks. We have to account for different factors like weather conditions, air pollutants at the moment when we will do the study, but these are all details we will put into the protocol writing. Basically, we hope that we then have a nice data set and samples to evaluate with the biosensor and correlate with the data from the environmental sensor. Furthermore, we talked about some pilot studies, which will not be clinical studies and will be conducted with students in the institute or in any way. And there it's more like the inter-sensor validation. Do they measure all the same amount of air pollutants and stuff like this was also discussed. But also for the further planning, we will start the protocol writing this year, but also we'll wait for the results from the first study so that maybe we can incorporate it into the ongoing design of the next trial.
And maybe also one example for how fruitful it can be to have other members from different disciplines or disciplines that are next to yours. Like Spiros, for example, gave quite handy hints on how to validate the environmental sensor we are developing right now. So thank you, and that's maybe also to encourage to like really exchange the information between different work packages or different disciplines. Are there questions?
great. Thank you.
Okay, thanks.
My glasses, since I'm old, I can't see without. I just won't be long because we've got already 2 tough days and 2 highly live days, I believe, which was the initial aim of this workshop or consortium meeting, to discuss with each other, and as Alexander just said, it's really important that we keep on that move, to discuss in between work packages and be really shy on sharing ideas, information, results, and so on, so that we can add our common expertise to each other. So that's really something important. The next thing that we have to do this year is we will have quite a bunch of deliverables coming in almost all work packages from 2 to 6, I believe, either at month 30, which is end of June, or month 36, which is end of December this year. And it brings me to the fact that there will be a new annual report that will be due in end of February next year. So we're discussing with Christina to begin the files to fill and so on before Christmas, so that depending on your holiday season in your individual countries, you will be able to feed us with all your remarks, reports, and so on. So be prepared to have another reporting period. Christina, will there be a review like we had? No? Okay. So that's good news. And probably, as discussed before, we will have a ethics review this year, since it should have been done since the first year actually of Remedia, but I guess for COVID issues and then restructuration of the departments at EC, which is responsible for us, they've been late, but it should come, it will come for sure at some point. So we're almost prepared, but Dan has sent us some questions and remaining questions that we have to answer, so be ready to answer to him. Next thing to organize, which is a little bit more fun than the report, is we envision to have a real ExCom meeting by the end of the year. We will do the monthly meetings, remote monthly meetings, as we're doing, and probably, as Patrice suggested, with maybe some of them at least focused on individual questions that we would like to solve collectively. But we'll need to find a date and a place for the for the ExCom meeting, so for WP leaders, and also to find a place. We've got time, but it's good to anticipate for the next consortium meeting that will take place in a year or so. I don't know. I know that this year we had thought of 2 options. Norway was an appealing option, but for COVID reason, you couldn't host us, and that's completely understandable. And we also had Spiros, so we made it with Spiros, which was really a good opportunity to come here to visit. But so we've got to think of next year. So if you've got proposition, if you would be happy to host the consortium meeting, please come back to us. And finally, I would like to thank, well, first of all, of course, Spiros for his hospitality and the organization of this meeting. That was, as anticipated, a great place to be and great organization. So thank you a lot. Thanks a lot. Yeah. I would like also to thank package leaders for their good work on updating us all about the different progress of the raw package during last year. And also for my birthday gift, that I haven't opened yet, but thanks a lot, and special thanks to Patrice for anticipating it, and to Spiros also to participate. And finally, I would like to thank you all for these live discussions, because I really believe, I don't know how you are feeling about it, but I really believe that thanks to this meeting, we have changed gear in Remedia and setting up the different working group in WP2, WP2-4 and 4 that we discussed before, and discussing with WP3 and so on. That's really something that was really needed for Remedia, as apart from the French part of Remedia, which is big, but there's not only French people in the consortium, and we didn't know that well each other because of COVID and because of how the project was built. But now it's a real great opportunity to now that we know each other more, to discuss together and to build on this discussion that we finally had live. So thank you all. Have a safe trip back, and see you virtually in a few, and hopefully for real next year. Thanks.
It's a great